to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. We're continuing our Health for the Holidays series, a special set of episodes where we explore how to stay healthy, balanced, and supported through the holiday season. Today's episode is especially important, and it's our final episode of the year for the Health for the Holidays. We're talking about what it's like to navigate diabetes during the holidays, and how you can still find your joy, connection, and peace while managing your health. The holiday season is a time filled with holiday traditions, get-togethers, community events, and more. Often, a large part of the festivities involves food. Christmas cookies, candy, pies, and many events, and even sometimes like secret family recipes, which I love. It's a tricky time to start a diet or just, eat healthy for just about anyone. November is Diabetes Awareness Month, so it is only fitting to discuss this topic here. However, it can be an especially challenging time of year for someone who is diabetic. And since November is Diabetic Awareness Month, it's only fitting to discuss this topic. Joining me today is Christine, a member of our team. Welcome, Christine. How are you this morning?
Hi, Dr. Borrelli. I'm great, and it's great to be here.
Thank you. Yes, I'm glad to have you. What do you think about healthy eating around the holidays? Is it hard to do?
Yes,
Silly question, right?
absolutely. Yeah, it's really hard, especially like eating desserts. You know what I mean? Like I love eating, sweet foods, so it's really hard.
What's your favorite holiday sweet?
Well, I have favorites. Like
Okay.
one of them are cookies
Hmm.
and like salad, not like salad like vegetable salad or something like that. Like macaroni, mac and
Nice.
cheese. I'm not sure if that's a dessert, but
Yeah, I
like
mean,
those
that
are the
works.
sweets. Food that I often eat during like Christmas, like the holidays. So yeah,
Yeah.
how about you?
I mean, I have a lot of sweets that that I like.
I
I
know.
love these special Christmas cookies that I love to eat every year with my
Hmm.
kids and my family. I also really like this Italian tradition sweet that is probably not the healthiest for you, but it's very, very good. It's called EDC, which is an Italian name, but it's a dough type sweet that has powdered sugar on the outside, and then
Yeah.
inside there's like a cannoli type cream inside, and it's kind of like in the shape of almost looks like a ball or a snowball.
Uh
It's
huh.
so good. They're amazing.
Yeah, I would love to try that.
Yeah, they're really good. They really are. I'm gonna have to have you taste them.
Yeah. So, Dr. Bradley, I know the holidays are such a busy, fun, exciting, and some people has like emotional time. Why can it be especially difficult for someone who's just received, a diagnosis like diabetes to get through the season?
No, that's a great question. And I think it's equally difficult for a person that is newly diagnosed with diabetes, or even someone that's been diagnosed, years ago and has been going on this journey for a while.
Mm.
But when you're managing something new, even if it's not diabetes, or a new diagnosis like heart disease or any other kind of condition, it adds a whole new layer of stress. I picked diabetes specifically to focus on because with that one, whether you're starting a new journey with the diagnosis or you've been on that journey for a while, it's very extra challenging when there's all these sweets and desserts and get-togethers with, everyone's bringing a dish, and you're kind of restricted to, what you can eat and how much you can eat, and having to keep an eye on your sugar and your carbs and all like that. So I think sometimes people forget that, that it's a whole extra layer of potential challenges and stress for those patients. And there's pressure to keep up with traditions, meals, and family gatherings. And many of those events center around food. So if you're someone struggling with diabetes, it's easy to feel like you're missing out or struggling to stay in control.
Yeah, exactly. So if you're someone who's recently, diagnosed with diabetes, maybe with chronic conditions even, and you want to stay on track, what's the best first step?
I would say planning ahead is key. It might sound really simple, but a little preparation goes a long way. Before attending a party or a gathering, think about what foods will be served and then consider bringing a dish that fits your meal plan. So at least you know you'll have something there that you're going to be able to eat. A lot of times, and I do this with my kids too sometimes, is like my kids are picky eaters, like I think many kids are. I will say they're getting a little better, but it's definitely a work in progress. So if
Yeah.
we are going to an event and I'm not quite sure exactly what kind of food's going to be there, I try to bring something that I know that they'll eat, but also I try to make sure they eat a good meal beforehand. So that way, if there's limited foods there, I know that at least they're getting, food that enough food and nutrition for that day. But also, I think what's really important is working with a nutritionist. This can help you choose foods that keep your blood sugar steady. And if that feels like a lot to manage on your own, a private patient advocate can help coordinate things like this. They can help support, connect you with the right professionals, and help you set up plans that work for your lifestyle. And also within your budget too. I think people think like, oh, wow, this extra help is going to cost an arm and a leg. And that's actually quite the opposite. A lot of times when you have the necessary tools, you end up saving money and time, which are both so important in life.
That's such an important point, you know. But what about emergencies, like, like a sudden spike or drop in blood sugar? How can someone prepare for that, during the holidays?
Yes, having an emergency plan is crucial. It doesn't have to be very complicated. It should just be very clear. So it's something that you can go to and you can follow the steps. That plan might include knowing the signs and symptoms of a spike or drop in your sugar, keeping rescue medications or glucose tabs on hand, and communicating with family or friends about what to do in case of an emergency. It also helps to have a go bag ready. So that's basically a bag that if you do have to go to the emergency or you have to go somewhere, you have it ready to go and you don't have to worry about grabbing things. One thing that I think a lot of people forget about in there is like a phone charger, because eventually you're going to want to contact and notify loved ones about where you're at and things like that. And you also have often important information stored on your phone. And in the heist of running around, a lot of people forget their phone charger. And everyone has different plugs, so it's hard to find one, to use after the fact. So, in addition to the phone charger, I would say essentials like medication, snacks, your insurance card if you have one, and things like that, just so you can quickly go and decrease that extra added stress during that time. And so, portable power pack is great too. If you're like me, your phone's always running on quite low battery. And so if I did not have a power charger, I think I would not be able to function on a daily basis. I actually had an episode, unexpectedly, of course, within this last week where I did have to be rushed to the hospital. And not really something I do often. I'm usually there, on the other end working. And so I rushed there. And when I was able to kind of access my phone, I had 1% left on my battery and then it died.
Oh
So
no.
if I did not have a power pack, basically I would have no phone available. So yeah.
That's the benefit of this holiday, series, I believe, because this way we can remind people to, hey, get ready and for emergencies, prepare a go bag, with essentials like power bank, medications, like all those kind of things that would help you, in this type of emergency. So that would really help you guys.
I agree. No, I agree. I think that's so essential. And, if you are already part of our Pathway Patient Advocate family, we also recommend our medical profile summary and other extra things to put in your go to bag. But we talk about those all the time, so we, we won't talk about it in this
Yeah.
episode. Um,
The holidays can be so emotional, and if someone sleeps up, maybe their sugar spikes up or they eat something they shouldn't, it can really feel discouraging, right? But what would you say to them, to those people?
Well, first, and I think this is a hard struggle for most people, including myself, give yourself grace. Nobody's perfect, and one rough day doesn't undo all the progress that you've made. The key is to learn from it rather than beat yourself up. So, you didn't fail at managing your diagnosis or your condition just because, you have to go to the hospital because let's say your sugar's out of whack or something like that. Give yourself give yourself grace because you're trying your best. Ask yourself what happened and then what can I adjust next time to prevent the same outcome, and then move forward. A private patient advocate can help you review what's wrong and make a personal plan to prevent it in the future. The goal isn't perfect, it's balance and consistency that you really need. And, as a professor myself, I do this with a lot with students. I think we're all so good at, or we've learned many times through the years, or many of us have learned to make plans. But I think one key aspect that is very easily or often forgotten is reviewing the plan, reviewing your progress, reviewing the outcome, and then making adjustments to make it work better. Because a lot of times we're like, oh, we made a plan, it didn't work. Well, I guess that, so much for that. And then you just stop. Well, that's only like less than half of, the steps that are required. You really need to review and revise. Those are such key components of the whole process.
Yeah, that's such a good advice, Dr. Borelli. Well, so for those who are navigating diabetes and maybe, feeling nervous or not feeling themselves and, about missing out, how can they still enjoy the holidays?
It's absolutely possible to enjoy the holidays. The key is balance and moderation. You can participate in traditions, enjoy a few treats, and still take care of yourself. Focus on what truly matters: time with loved ones, making memories, and celebrating life. When you take care of your health, you actually have more energy and peace of mind to enjoy those moments fully.
That's such a powerful message, Dr. Borelli. Well, yeah, the holidays doesn't have to be perfect. They just have to be meaningful and mindful, right?
Exactly. And if anyone listening feels overwhelmed or needs help managing diabetes, Pathway Patient Advocates is here to help. We can coordinate care, work with your providers, and help you find balance so that you can focus on what's important: your health and your loved ones.
Very well said. Well, for anyone looking for help for themselves or for their loved ones, there are so many ways to reach out to us. Give us a call at 947-517-8395, or you can visit our website at www.pathwaypa.com.
Thank you, Christine. It's been a pleasure as always. I hope this conversation helps our listeners feel more confident as they navigate their healthcare journeys. Bye. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.